The problem is the heart surgeons, because they have patients with low cholesterol levels who are having heart attacks. What causes heart disease is damage to the arterial wall. Dr. Agatha Thrash, she is passed now, but she's a famous doctor who started Uchee Pines. She used to give this story. She had a lady come to her who was an alcoholic, and she had 80% occlusion of her main arteries. She went on a plant-based diet, started walking every day, exercise, walking. Plant-based diet. 10 months later, an embolism in her brain burst and she died. You see, because of all of those years of drinking alcohol, it had weakened her arteries.
There's a reason most people have never been told to check their heart and circulation at home. And it's not because it doesn't work. If more people did these simple tests, they could catch circulation problems years before they turn into serious issues. That would mean fewer prescriptions, fewer surgeries, and less money flowing into the healthcare system. Right now, millions of adults over 50 live with silent circulation issues. They feel tired, short of breath, or notice cold hands and feet, but never connect the dots. Many are told it's just normal aging, when in fact poor circulation can quietly raise the risk of heart disease, stroke, or memory decline. The truth is that 4 easy at-home tests exist, and they don't require expensive machines or doctor's visits. You can check your heart recovery rate, your resting heart rhythm, your artery health, and even your blood flow to the hands, all without leaving your house. These methods are safe, take only a few minutes, and may give you life-saving insights about what's happening inside your body. And there's more. Beyond testing, there are natural, lesser-known ways to improve circulation and heart health that don't rely on drugs or surgery. These methods are built around foods, herbs, and daily habits that the pharmaceutical industry can't patent, which is exactly why most people never hear about them. Before we begin, share in the comments where you're watching from and whether you've ever tested your heart or circulation at home. Do you notice cold hands, swelling ankles, or low energy? We're reading every reply. Now let's start with the very first test you can try today. Number 1, step test, heart recovery rate. One of the simplest ways to check your heart and circulation health at home is through something called the step test. This test doesn't require any special machines, expensive tools, or even a trip to the clinic. All you need is a sturdy step, a timer, and a little bit of space. The step test focuses on how quickly your heart recovers after physical activity, and that single measure can tell you a lot about your cardiovascular health, your fitness level, and even your risk of developing problems later in life. When you exercise, your heart rate goes up because your muscles need more oxygen. Your heart works harder to pump blood and deliver that oxygen where it is needed. Once you stop exercising, a healthy heart should be able to slow down fairly quickly and return to a resting rhythm. The faster it recovers, the stronger and more efficient it usually is. If it takes a long time for your heart rate to return to normal, that can be a sign that your cardiovascular system is under stress or that your fitness level is not where it should be. This is why the step test is so useful. To do the step test, you'll need a step that's about 12 inches high. Some people use an exercise step platform, but you can also use the bottom step of a staircase if it is stable. You'll also need a stopwatch or the timer function on your phone. The standard version of the test involves stepping up and down in a regular rhythm for 3 minutes. Usually the pace is set at about 24 steps per minute, which means 1 step up and 1 step down every 2.5 seconds. You can count in your head or even use a metronome app to help you keep the rhythm. Start by warming up for a couple of minutes by walking around at a comfortable pace. Once you feel ready, begin the test by stepping up with your left foot, then your right, and then stepping down with your left and right again. Keep repeating this pattern for 3 full minutes. Try to keep your pace steady and avoid rushing. At the end of 3 minutes, sit down right away and check your pulse. Count the number of beats for 60 seconds or count for 30 seconds and multiply by 2. This is your recovery heart rate. The key measurement here is not just the number itself, but how it compares to your resting heart rate and how quickly it returns to normal. For example, a fit and healthy person might finish the step test with a heart rate of around 120 to 140 beats per minute. But within a minute of sitting down, that number should drop significantly, often by 20 to 30 beats. By the second minute, it should drop even further. If your heart rate stays high for several minutes after stopping, that suggests your heart and circulation are having to work harder than they should. Researchers have studied recovery heart rate for decades, and they've found that it is one of the strongest predictors of long-term heart health. People who have slower recovery rates after exercise tend to have a higher risk of heart disease and even early death. On the other hand, people who recover quickly usually have stronger hearts and better circulation. This doesn't mean the step test can diagnose medical problems, but it can give you a very clear idea of whether your fitness and heart health are in good shape. One of the reasons the step test is so valuable is that it can show improvements over time. If you make changes to your lifestyle, such as adding more physical activity, eating healthier, or losing weight, you might notice that your recovery heart rate improves after a few weeks or months. That's your body telling you that your heart has become stronger and more efficient. Many people use this test as a personal fitness tracker without needing fancy devices. Another important point is that the step test is relatively safe for most people. It is a low-intensity activity compared to running or sprinting. However, if you have joint problems, severe arthritis, or balance issues, you should be cautious and consider modifying the test. For example, instead of stepping up and down, you could march in place for 3 minutes and then measure your recovery rate in the same way. The results won't be exactly the same as the step test, but they will still give you useful information about your heart's response to activity. When interpreting your results, there are some general guidelines that people often use. For adults under 40, a recovery heart rate that drops by more than 25 beats in the first minute after exercise is usually considered a good sign. For adults over 60, a drop of 15 to 20 beats is still considered healthy. If your heart rate barely drops or even stays elevated after 2 minutes, that might be a signal that you should talk to your doctor about your cardiovascular health. Number 2, resting heart rate count. Resting heart rate is one of the simplest signals your body gives you about heart and circulation health. It is the number of times your heart beats each minute while you are calm and still. Measuring it correctly is easy, costs nothing, and gives useful information you can track over time. Do the test first thing in the morning while you are still lying in bed and before you get up, eat or drink anything. This gives the most consistent reading because activity, food, caffeine, and stress all raise heart rate. Use a quiet alarm or your phone so you can sit up just enough to check your pulse without moving around much. You can measure your pulse at the wrist or the neck. To use the wrist, place the pads of your index and middle fingers on the inside of your opposite wrist, just below the base of the thumb. You should not press too hard. You will feel a steady beat. If you use the neck, place those same 2 fingers gently at the side of your neck where you feel the main artery. Once you find the pulse, count beats for 60 seconds. If you prefer, count for 30 seconds and multiply by 2. But counting a full 60 seconds is easiest and least likely to introduce math errors. If you have a heart rate monitor, a smartwatch, or a fitness band that measures heart rate, you can use that instead. Just be sure the device is charged and worn the same way each morning so readings stay consistent. Some devices display the resting heart rate automatically after a few minutes of stillness. What numbers are normal? For most adults, a resting heart rate between 60 and 100 beats per minute is considered within a common range. For people who exercise regularly, especially endurance athletes, resting heart rate can be lower, sometimes 40 to 60 beats per minute, and that may reflect a stronger heart. For older adults, higher numbers are more common, but a steady rise over months is a sign to pay attention to. If your resting heart rate is regularly above 90 or below 50 and you are not an athlete, it is a good idea to mention it to your doctor. Several factors change resting heart rate: fever, dehydration, poor sleep, anxiety, alcohol, caffeine, some medications, and even cold weather can raise it. Illness or pain can raise it too. A lower resting heart rate is not always better. When it is linked to dizziness, fainting, or shortness of breath, it can signal a problem. The key is the trend. Take the reading at the same time each morning and write it down or use an app. Track it for at least 2 weeks to see whether it stays fairly stable, goes down with fitness improvement, or rises. If you want a simple routine to follow, measure your pulse for 60 seconds each morning for 2 weeks, then calculate the average. If the average is within your expected range and you feel well, keep monitoring monthly or as you change your exercise and sleep habits. If the average rises by more than 5 to 10 beats per minute over a month, or if you feel symptoms like chest tightness, unexplained fatigue, or fainting, contact your healthcare provider. You can use resting heart rate to guide small changes that improve heart and circulation health. Regular aerobic activity such as brisk walking, cycling, swimming, or dancing tends to lower resting heart rate over time. Improving sleep quality, cutting back on caffeine and alcohol, managing stress with breathing or relaxation exercises, and losing excess weight all help. Medications can also change your numbers, so tell your doctor about any drugs you take if you are tracking heart rate.
Number 3, ankle brachial index, pulse check for arteries. The ankle brachial index, or ABI, is a standard test used to check blood flow to the legs. In clinics, it is measured with a blood pressure cuff and a Doppler probe at the ankle and arm. At home, you can do a simplified version that gives useful clues. And if you have a home blood pressure cuff that fits the ankle area, you can calculate a basic ABI number. The goal is to detect reduced blood flow that may point to blocked arteries in the legs, a condition called peripheral artery disease, PAD. PAD matters because it raises the risk of heart attack, stroke, wounds that won't heal, and limits walking ability. If you do not have special tools, you can still check pulses by feeling them. Do the test in a warm room. Lie down or sit with feet relaxed and supported. First, find the radial pulse at the wrist or the pulse in the arm to know what a normal strong pulse feels like. Then find 2 pulses in the ankle. The dorsalis pedis pulse, which runs on the top of the foot near the base of the big toe, and the posterior tibial pulse, which is felt behind the inner ankle bone. Use the pads of your index and middle fingers and press gently until you feel a beat. Compare the strength of the ankle pulses to the wrist pulse. If the ankle pulse is similar or stronger, that is normal for most people. If the ankle pulses are faint, very hard to find, or absent while the wrist pulse is strong, that suggests reduced blood flow and you should see a clinician. Do the check on both legs and note any differences. If one leg feels noticeably weaker, that is an important detail to report. If you have a home blood pressure cuff that can wrap around the lower calf or the ankle, you can measure a simple ABI. Take a normal arm systolic pressure first. Then place the cuff on the ankle or lower calf and raise the pressure until the pulse at the artery disappears, then slowly release until it returns. That gives the ankle systolic pressure. The ABI is the ankle systolic divided by the higher of the 2 arm systolic pressures. A quick guide to results. An ABI between 1.0 and 1.4 is normal. 0.9 or less suggests PAD. 0.4 to 0.9 indicates mild to moderate PAD. Under 0.4 indicates severe PAD. An ABI above 1.4 can mean stiff arteries and the test might not be accurate, so ask a doctor about further testing. If you find weak ankle pulses or an ABI below about 0.9, don't panic, but act. Lifestyle steps that help circulation include quitting smoking, getting regular walking exercise, managing blood pressure and cholesterol, controlling blood sugar if you have diabetes, and maintaining a healthy weight. Walking is especially helpful for people with mild PAD. A supervised walking program or a simple daily walking routine that gradually increases work time can improve circulation and walking distance. Also protect your feet. Reduced blood flow makes cuts and blisters slower to heal. Check your feet daily for sores, redness, or swelling.
Keep skin moisturized, but avoid cutting off calluses yourself if you have poor circulation. Seek professional foot care. Wear comfortable shoes that fit well. If you notice persistent pain in the calf when you walk that stops when you rest, that is classic claudication and should prompt medical review. A BI and pulse checks are a screening step. They cannot replace imaging tests that a vascular specialist can perform, such as duplex ultrasound, CT angiography, or ankle-to-toe Doppler studies. If home tests suggest a problem, your doctor may order more precise tests, and if needed, treatments such as medicines to improve blood flow, supervised exercise, or procedures to open blocked vessels.
Number 4, hand temperature test, blood flow check. Hand temperature is a simple way to sense how well blood is reaching your hands. Cold hands can come from many causes: the room temperature, nervousness, low thyroid activity, certain medicines, smoking, nerve problems, or poor circulation. The hand temperature test looks at temperature changes and differences between hands to screen for circulation or nerve issues. Pick a calm, warm room and sit quietly for 10 minutes to get your body into a steady state. Remove gloves, watches, and rings that might affect circulation. If you have an infrared thermometer, a skin surface thermometer, or a household digital thermometer, you can use it for a more objective reading. If you do not have a thermometer, the test still works subjectively. Place your palms flat against the palms of a friend or compare your hands to your own forehead or cheeks. To do an objective test, point an infrared thermometer at the back of one hand from the same short distance each time and record the temperature. Repeat on the same spot on the other hand. Normal skin temperature on the hands depends on room temperature, but a consistent difference of more than about 2 degrees Celsius, roughly 3.5 to 4 degrees Fahrenheit, from one hand to the other is worth noting. Also measure the temperature again after a simple warm-up. Run warm, not hot water over your hands for 30 to 60 seconds. Dry them, then remeasure. If the hand temperature rises after warming, that shows the blood vessels can respond and deliver more blood. If the hand stays cold despite warming, that may mean a circulation problem or nerve issue. A second useful step is the cold recovery test. Place your hands in cool water for 10 to 20 seconds, then remove and time how long it takes for them to feel normal again. Healthy circulation brings warmth back quickly. If one hand takes much longer than the other to warm up, that difference is important to report to a clinician. Hand temperature can also be checked in response to activity. Squeeze a softball or tap your fingertips together for a minute, then measure temperature. A normal response is a small rise in skin temperature as blood flow increases. A lack of response suggests reduced blood supply or autonomic nerve changes. There are conditions that commonly cause cold hands. Raynaud's phenomenon causes small arteries in the fingers to constrict sharply when exposed to cold or stress, producing a characteristic color change and cold feeling. Diabetes and nerve damage can lower skin temperature by affecting nerve signals. Peripheral artery disease of the arms is less common than in the legs, but it can happen. Low thyroid function slows metabolism and can make the skin feel cool. Several medicines, including some for high blood pressure, can reduce peripheral blood flow. If a hand temperature test at home shows one hand persistently colder than the other, or if you have numbness, color change, persistent pain, slow healing wounds, or loss of feeling, contact your doctor. They may order tests such as Doppler studies, nerve conduction studies, or blood tests to find the cause. Simple steps you can take right away include keeping hands warm with gloves, quitting smoking, staying active, avoiding tight jewelry or clothing that can restrict flow, and using regular hand exercises and massage to stimulate blood flow. Now let's discuss some powerful natural tips you can use to help heart and circulation health. Start a small daily shot of beetroot or blend raw beet with a little apple. Beets are high in natural nitrates that the body converts to nitric oxide. That helps blood vessels relax and lowers blood pressure a bit. Don't use strong antibacterial mouthwash around the time you take beet juice, because the mouth bacteria help that conversion.
Add a spoon of pomegranate concentrate or a small glass of fresh pomegranate juice a few times a week. Pomegranate has plant compounds that help blood vessel lining work better. You can also eat the seeds with yogurt or salads. Try a standardised hawthorn extract only after talking to your clinician. In measured doses, hawthorn can gently help circulation and exercise tolerance for some people. It can interact with heart medicines, so use it under supervision. Use bergamot tea or a bergamot-enriched citrus blend as a routine drink. Bergamot contains flavonoids that can help lower LDL cholesterol for some people when used alongside diet changes. Pick products that list a consistent ingredient amount and discuss with your provider. Add watermelon or a small scoop of citrulline powder before light exercise. Citrulline is a plant compound that the body turns into arginine, which supports nitric oxide production and can help widen small vessels. Support your oral microbiome naturally. Eat more leafy greens, avoid overusing antiseptic mouthwashes, and keep gums healthy with gentle brushing and flossing. Healthy mouth bacteria help turn dietary nitrate into beneficial compounds for circulation, include gentle daily hand and foot massage and short brisk walks after meals. Massage and light movement increase local blood flow and encourage small vessels to stay flexible. Thanks for watching. I hope you found this video helpful. Don't forget to subscribe for more health tips and stay tuned for the next one.